And we also do a lot of functional assessments, not for diagnosing disease because they're not for that, for helping people feel good and live long. And when you see a functional lab that informs a treatment plan that you may not have considered without the lab, and then within 2 weeks, their whole life is changed, you can't forget that. You can't forget that that lab changed the way that you approached what you were going to do for this person. And that's what I love. Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Duizer. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare.
Welcome to a special episode of Personalized, brought to you by Vitamin Lab. My name is Lydia Thurton. I'm a naturopathic doctor, producer of this podcast, and I manage some of our Vitamin Lab accounts. In today's episode, I interview our host, the esteemed Dr. David Duizer ND. He's a former Canadian naval officer, a well-respected naturopathic doctor, and clinic operator. He's the co-founder of Noble Naturopathic Clinic in Vancouver, BC, where he focuses on supporting individuals in optimizing their health. He treats a range of conditions from adjunct cancer care to optimizing athletic performance. He is the president of the board at the Canadian College of Naturopathic Medicine and serves as an instructor at the Institute for Holistic Nutrition. Dr. Duizer remains committed to advancing naturopathic education through his speaking endeavors. He is also a husband and father. Welcome to this special episode. We truly hope you enjoy. Hi, everyone. Welcome to the Personalized Podcast with Dr. David Duizer. And today we are doing something cool and different. I am Lydia Thurton, and I am the podcast producer. And today we're going to be interviewing Dr. Duizer and learning more about his practice and what brought him to naturopathic medicine and just the unique ways that he personalizes care for his patients. Hi, David. Thanks for joining us today.
Hi, Lydia. Thanks for having me.
Yeah, of course. So it's so interesting to me because you have a few niches in your practice, including cancer care, and you're treating athletes. Tell us a little bit about your journey. How did you come to this area of practice?
Well, I came to naturopathic medicine, oh my gosh, so many years ago now. I thought was a kind of a unique journey. I worked in a chiropractor office when I was in high school, chiropractor's office as the assistant. I always wanted to be in medicine. I wanted to be a physician. In my small town, I didn't really know where to volunteer, what to do, where to work to get more experience, but I knew I liked my chiropractor and I was offered a job to work with him. So I worked there and loved what he was doing, saw the benefits he was giving to people, and the care that he was providing was really cool. He was doing some unique things. He was into technology just like I am. Mm-hmm. And then I went and did my undergraduate in the military in chemistry and psychology, so a double major, trying to be as well-rounded as possible. And then I thought, okay, I really want to be a military physician. Turned out for me that it really wasn't in the cards. They weren't looking for military physicians at the time. The profession that I was in was not something that they wanted to take people out of. I was a naval navigator. And at the time I was posted to Esquimalt, and I living in Victoria, where naturopathic medicine is quite popular. And I learned a lot about it very quickly just from my community members, and learned that they could do chiropractic, or you would say manipulation. They could do physical medicine. And that was very interesting to me. But also then in British Columbia, they were providing primary care. And that was something I wanted to be doing. I wanted to be a family physician. And so I decided that I would pursue this career of becoming a naturopath, considering it suited my family history. In my family, both my wife's family and in my family, there's a sort of a big drive for lifestyle medicine. And that drive is quite instilled in me. Healthy nutrition, for example, exercise. My father-in-law worked with an apothecary on the East Coast during his cancer care and found a lot of value in what he was doing with that natural pharmacy, East Coast natural pharmacy. And so I was quite inspired by all of that. And so I was able to find a career that kind of fit all three. My experience, the family experience, for example, and it actually worked out really well. So that's how I got here.
That's amazing. What a journey. Wow. Tell us about how naturopathic doctors position themselves with cancer care, because we're offering adjunct care to the traditional methods, but I think there's a lot that we can offer patients.
Oh, it's incredibly supportive. For example, there's tons of evidence for side effect reduction for the things that we do.
Mm-hmm.
So in this practice, we're helping people not lose too much weight during their treatment. So when appetite goes down, what happens? So we prescribe custom meal plans, for example, that help people maintain their weight. We make sure while they're working on maintaining their weight, they're keeping their muscle mass on, because the therapies that are being provided are incredibly effective nowadays. And the issue really is that afterwards, the deconditioning is significant. The cardiovascular risk is significant. The side effects are more pronounced if someone is, for example, becoming deconditioned or not eating well and not exercising. And so we know those are good things we can do, and they're easy to prescribe, and they're well within our scope. So we do that kind of supportive medicine. So keeping the weight on, keeping the muscle mass on. And then my favorite thing is to measure VO2 max. So I like to measure VO2 max for people who have been diagnosed with cancer, which is how fit a person is, and help them actually work on improving. So even during the therapy, for example, we can find limitations in their physical fitness, and we can work on that. The people who have the highest VO2 max do the best, live the longest, and the fittest people get the least amount of side effects and do the best during conventional care. So that's kind of my focus, very supportive, helping keeping the nutrients stable and the weight stable and the fitness high.
Tell us what that looks like from a clinic setup perspective. Like if a practitioner would like to be offering this in their clinic, what sort of tools would they need in their space?
Well, I have slowly built this over the years. So I wouldn't expect if someone got really interested in this to buy all the tools right away, because it can be quite expensive. But from a basic standpoint, you can predict someone's metabolism using a very simple calculator. We use a Harris-Benedict equation, for example, when we don't actually do a metabolic test, to determine how many calories a person's burning per day. And in cancer care, they really need to be eating, at least in maintenance, preferably like a little more than maintenance, or focusing on making sure that they can consume the maintenance and maybe targeting a little bit higher, specific on the protein macronutrient. So you can do calculation, for example, calculate metabolism. We actually measure metabolism because I have a Pinoy metabolic analysis device. So because we do physiology here, we're able to measure resting rate. We're able to determine how much food a person is supposed to be eating. So it's a device that could be bought in. There are other devices that do exactly the same thing. And so lots on the market to choose from. So metabolism can be measured, meal plans can be individualized. And that's my favorite thing to do. But the second thing is a body composition scale can tell you everything you need to know about the volume of muscle. And the ones that are used at home are pretty good for like the lower leg. And that's okay, right? We have a really good one that does the whole body. However, even if someone just has an inexpensive body composition scale, at least you can see the trend of muscle. It may not be the right number, like it's not as, if it's an at-home scale, it's not going to be as close as a DEXA scan. But for example, if someone's scale showed they had 80 pounds of muscle and 2 weeks later it showed that it was less than 80, who cares if the 80 was right? The trend was down, and we have to change what we're doing. So the $60 body composition scale that's available online, and those could be fine for tracking the trends. So it doesn't have to be expensive. In terms of setup, of course, I have a treadmill and a bike and a room for intravenous therapy and an office where I can actually do the resting tests and have consultations. So really, I have these 3 rooms that I use every day, and I kind of float between the 3 of them. So that's kind of the setup I have. Body composition scale, I have the in-body, Pinoy metabolism analysis device, an IV room, and a treadmill and a bike.
Amazing. Okay. Yeah, it's good to know about the different tools that physicians are using. I want to dive into meal planning because I find that compliance can sometimes be low when you're telling people what they should be eating. It's not easy for people to make behavior change with their diet at times. So what are some tricks that you've learned over the years in terms of constructing a meal plan that people will actually follow?
Definitely. So we ask what things they avoid. We ask where they consume any liquid calories. So if they have cream in their coffee, for example, or if they have alcohol or whatever. We ask what their favorite healthy foods are. And we ask how many meals they eat per day.
Okay.
And then we use something called Evolution Nutrition, which is an online tool that helps us to populate a meal plan and then make adjustments that suit the person's style of eating. So when they see a plan, say, for example, they like to have a dinner that is Indian cuisine every evening. Well, when they look at their plan, every evening it has Indian cuisine because that's what we've chosen. So it's individualized meal programming. For example, just like how Dr. Gupta on my recent episode, he mentioned that the most important thing he sees with his weight loss patients is to have foods on the plan that they actually like.
Yeah.
And I have seen that throughout my entire career. I started with just Mediterranean diet programming. That's what I basically gave to everyone. Mediterranean, low glycemic. But now what we're able to do is we're able to individualize that and kind of have the principles of care that we would want from those two types of diets, but integrate it into a person's meal plan while including some of their favorite foods. We put sushi on plans. We put pizza on plans. We do everything to try to make it easy to follow. Then at the bottom of these meals, it will have my targets. So for example, it will say the calories and the protein, the fats and the carbs. And along the right-hand side, it will say the portion sizes. And so what we say is like, don't worry about along the bottom. That's for me. What you worry about is the portion size. If there's something you don't like, we can either make a quick substitution via email. So we do that. People just say, hey, on day 3, I don't like this. Could you do this? And we just make a quick change because it takes 1 second. Or we say, make a smart sub. If it's a vegetable you don't like, you can simply eat another vegetable. It's going to have almost exactly the same calories if you eat the same portion size. So people make adaptations on the fly, and that has really worked for me. Some people like to be mono food eaters. So we'll say if you find 1 or 2 days you really like, during cancer care, you can repeat those over and over. Like that's fine with me. So we try to find strategies that suit the person, and then we think about accountability in an individualized manner. Do you think you need to come back in 2 weeks to check on this? Or maybe you'd be fine for 4 to 6 weeks. And so we kind of leave it up to the person to say what they need. And then at the end, we typically say, we've chosen this, like you're going to come back in 6 weeks. But if anything comes up, either message me or just come in and we'll make adjustments as we go.
Do you have your patients weighing food, or are they eyeballing it?
So typically the proteins will be in grams.
Okay.
But but always the back package will have a profile that teaches you how to eyeball the grams. So for proteins, eyeballing the grams, deck of cards is this much grams. Very, very simple.
Yeah.
Everything else is in cups and tablespoons, which everyone has.
Yes. Okay. So they are weighing food and measuring it in the beginning, at least.
They're measuring, but not weighing. We don't require that everyone buys a scale.
Okay. They're just, we'll use a point of reference. Okay. That's so interesting. And tell me about exercise prescriptions. If somebody is, having cancer treatments, what sort of exercise could they or should they be doing?
Well, in the days after chemotherapy, just like in the days after surgery, we don't do anything. But the other days, of course, there's lots that we can be doing. The stimulus to really maintain muscle is only once a week. You can maintain muscle if you train that muscle once a week in a set and rep range that's between 3 and 8 reps with 1 to 2 reps in reserve. So not to exhaustion, but maybe 1 or 2 reps away from exhaustion. So if we have an opportunity on the off chemo weeks to lift weights or to do some type of activity that's going to challenge the whole body, that's highly favorable. More than that is a little bit better. Less than that will cause muscle loss. No ifs. On the cardiovascular side, I still like to train for limitations. So for example, if someone's feeling good, say that you're doing chemo every 3 weeks, on the second week, so if they have a week to recover from the session, they can integrate cardiovascular activity back into their day, of course. And if they're feeling inspired, then we'll train for limitations. Say, for example, they're limited in zone 2, 3, or 4. We might do a specific exercise that's within one of those zones. If they're not inspired and they just need to be making sure they're maintaining their base aerobic capacity, any movement is good movement. So we typically think about the Health Canada recommendations of 150 minutes a week. I'm all in. They'll say moderate activity. We tell the patient what is moderate activity for them. If it's too intense, it doesn't really matter. We just need movement. And so we program whatever a person can do. Very often it's swimming, going for walks, going for light bike rides, that sort of thing.
I know you have a history of athletics. You were on your university basketball team, right?
I was.
Tell me what athletes are missing in their care, particularly if they're injured, prone to injury, or how could we be better supporting our patients that are athletes?
Oh, I love that question. That's super loaded. Okay, that's a good one. How can we better support athletes? Well, the first thing that comes to mind is the nutrition requirements.
Okay.
We've been
Talk
doing
about
this
it.
metabolism test for people who are starting to specialize. So around between the ages of 12 and 14, kids will typically, in my city, start to become very serious with sport. And they'll stop being, multidimensional, playing multiple sports. They'll just focus on one. And very commonly what happens is they're going through a growth spurt, they're being hit with testosterone, and all of a sudden what happens is they're really hungry and growing super fast, but at the same time the demands are incredibly high. So we've been measuring resting rate and finding that it's ridiculously high at this time, of course. And so the level of food that's required is a significant volume. Within that significant volume, it's not like the protein is absurdly high because they don't weigh a lot yet. However, you'll notice that teenagers will eat 6 to 8 times a day. And this is why they have a huge energy expenditure. So my favorite thing is to tell them what that is and to make a meal plan that fits that. So they don't have to be thinking about calories, but they have to be thinking about the volume of food that's going to be supportive of them and what the balance of macronutrients should be for them in order to put on as much muscle mass, as much lean muscle mass as possible, so that they can be as light as possible, but also as strong as possible. So we have that aspect, which is like, this is how much food you need to be eating. It should be healthy foods. And here are some examples, right? That's pretty simple. I think adult athletes fail in this manner as well. And they don't have a good sense of what they're expending. And very often they either overeat the wrong foods or undereat in total. And then they don't get the benefits. But the key risk in the undereating group for both teenagers and adults is really the pre-exercise meals, right? So having that carbohydrate, if you want to perform well, 40 to 60 grams of liquid carbs as a form of a smoothie 1 hour before the event, and actually consuming even a little bit more carbs, as in like 100 to 120 grams, maybe in the 3 hours before the event. So that really, really improves performance. And then of course, focusing on protein for the recovery. People don't think about that a lot. They think about carb loading the day before, 2 days before, and then they eat 300 grams of carbs and they feel heavy and bloated and their digestion's off. It's not super helpful unless you're only focusing on being an endurance athlete. For everyone else, these pre-exercise meals are incredibly important and they improve performance significantly. So that's been my focus, is like teaching them, what does pre-exercise meal programming look like and how can you integrate that and make it super simple? My favorite thing to think about is how incorrectly I trained as a teenager. That's what inspires me.
Tell us.
I wanted to dunk the basketball, but I'm only 5'10". So I invested, but there's lots of people who are 5'10" who can dunk. I invested in all of the best jump programs and I followed them and I did them because my discipline at that time and still remains to be very good. But at the same time, I also wanted to be the fittest person on the court and the fittest person in all the sports that I was playing. So I would train endurance and I would train them on the same day. So I would train plyometrics and heavy squats, and I would train power and strength and plyometrics and endurance all on the same day. And because of my genetics, I have more slow twitch muscle fibers. And you can imagine I wasn't able to create fast twitch muscle fibers. Even though I did everything right, it seemed like what I was doing was evidence-based for the creation of fast twitch muscle fibers. You cannot train endurance on the same day as trying to develop fast twitch muscle fibers. It doesn't work. And so I was not reaping the benefits of all the work that I was having. So I'm trying to help teenagers to not do that. So to have appropriate periodization. So I went and became a strength and conditioning coach, a CSCS, to learn about correct periodization. I have a significant amount of athletes coming into my practice as the one of the metabolic streams that I work within. So I decided to get trained so that I could help them not make the same mistakes I did. And we've had good success in that realm. So I'm quite proud of that.
Oh, that must be so rewarding. Are your children, you have three kids, right?
I do.
Yeah. Are they involved in sports and athletics?
Oh yes, of course. We're doing it all. My kids are 2, 5, and 7, so it's not
Oh, they're
serious.
little.
And
Yes.
yeah, they're very little. Yeah, but they're in soccer and they're in baseball and they're doing lots of activities around the city, cross country running already. All the good stuff.
Amazing. Oh, that must be so rewarding to see teenagers avoiding injury, training to their maximum capacity. Probably some of them are getting scholarships to go to university in different places. It's awesome.
Definitely. Yeah, it's really inspiring.
Amazing. How do you balance being a dad of three kids and running a very busy practice? And you're also on the you're chairman of the board, which we'll get to. But how do you strike that balance? Your wife must be pretty awesome too.
She's awesome. Yeah, she's the only reason I'm able to do all of this.
Yeah, that makes sense.
Yeah, because I don't have balance. I don't have balance. And we've kind of made the decision at this point in my career and in our lives that there will be no balance for a little while. And that's something that I feel like some people have to decide to do.
Mm-hmm.
If you're trying to accomplish something, larger than yourself, then this is what has to happen very often. And so I've accepted that. And there really is no balance, but mainly it's because I really like what I do, and I'm trying to make positive change in as many people's lives as possible. But that being said, I'm obsessed with being a dad, and I just love being a dad. I think it's the most important job that I have.
Mm-hmm.
So I'm working on maybe shifting the output, towards their activities and less towards mine. So I try not to miss things.
Mm-hmm. Mm-hmm. Well, I guess being a business owner, you're in control of your schedule to a certain degree. So you can probably make some concessions where you need to. Yeah. What's it like owning a naturopathic practice? Because there's certainly going to be some learning curves, I'm sure, as you opened up your doors. Although, did you take over a practice? I think, did you inherit a practice?
We purchased a
You did?
practice.
Okay.
Yeah, we purchased
Okay.
a practice. A partner and I purchased this practice so that we were already working in.
Mm-hmm.
And so it was a difficult start in the sense that we were closed for the first 6 weeks because it was the time when every practice was closed, April 1st, 2020, for COVID restrictions.
That's when you purchased the practice. It just happened to coincide with.
That was our first day.
Oh my God.
Yeah, first day was the day that we closed.
Welcome to business. Okay.
Thank you.
Yeah.
Yeah. Thank you. Yeah, but
Yeah.
we fortunately we had a great telemedicine practice going at the time. We were fine. The transition was easy for us. But owning a practice is incredibly rewarding. I enjoy it so much. In fact, we're expanding. We have a second location opening up soon. We're excited to bring what we're doing to other communities. We focus on really two aspects of clinical practice: solidarity and agency. Solidarity in the sense that we move together with a very similar goal to help as many people heal as naturally as possible. And then through agency, we have unique practices. Everyone who works with us does something a little bit different, maybe assesses a different way or treats a different way or has a different sort of focus, sort of niche. And so we have agency in our practice. And so if we keep those two things top of mind, I think we're going to do really well. Already, the practice is significantly growing each year in the first 3 years. And so we're quite proud of that.
Amazing. When you bring on new practitioners to work with you, what sort of qualities are you looking for in a new hire?
Qualities in a new hire. Ooh, I like that. Passion.
Yeah.
Passion. Willing to connect with people. Willing to be there for a person. The people that we work with here, they work really hard. They're responsive to their patients. They enjoy what they do. They like coming to work. They want to see as many people as they possibly can see. They're not simply coming in and just kind of clocking hours. It's not really like that. So we're looking for people who are really inspired to do good work. In addition, we try to be evidence-based. We try to support people holistically. So we have all these kind of like little pieces, little pillars that we kind of focus on. And then right on top of that, we all have unique practices.
Like, would there be some overlap in terms of sports medicine and cancer care, or people are doing really different things?
Oh, definitely. Yeah. So there's 2 physicians who own the practice here, and then we have 3 associates and 1 more joining soon. And so within each of our practices, we all have some experience supporting people with weight loss, of course, because it's a big part of our clinic as a whole. But then one of our practitioners, for example, does iron IVs and NAD IVs, has an advanced IV practice. That naturopathic physician is also a registered massage therapist. We have a practitioner who has a very deep history in sport like I do, and has desired to work with athletes and has already been working with athletes and has been using the metabolism device in a similar way I do. So there's some overlap there. And then we have another practitioner who has more experience than others in the supplementation world and in the nutrient support world. And their focus really is on clinical nutrition and supplemental support. So we have some uniqueness about us, but then at its foundation, we're all quite traditional naturopaths in the sense that we all work on digestion and hormones and think holistically.
Yeah, that sounds very cohesive, like it fits together really well.
Yeah, it is. It's a joy to come into work.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
You mentioned a specific certification, and I think that would be helpful if you're a new grad or a doctor and you're interested in learning and more about sports medicine and exercise. What was the certification that you mentioned, please?
It's called CSCS, Certified Strength and Conditioning Specialist.
Yeah.
And it's an excellent certification in the sense that it gives you all the background you need to create really, really, really good periodization for athletes. So how to train and when in the cycle of the year. And it's a required certification if you're working with athletes, for example, at the university level or at the professional level. Typically, if you're going to be working in programming their strength and conditioning, you have to have this or something very similar. So it made a lot of sense for my practice. But I think the overarching theme here is that we don't all have to niche. I do very strongly believe that we should be generalists at the start and for much of our practice, that we should be helping as many people as possible because we have really, really, really excellent education that's incredibly well-rounded as a whole. And we have an opportunity to use the tools that we've simply learned in school to help a significant number of people. But then we also have this opportunity to do advanced courses. There's courses in lipids. There's courses in cancer care. There's courses in so many different things. There's courses that are even more specific, like exercise in cancer care. And of course, now there's courses in endocrinology and in pediatrics and OB, lots of different courses that can be taken that help you maybe niche further down and have that kind of maybe the most interesting part of your day, maybe you spending time within that niche. And that's incredibly rewarding as a clinician. Like if that's where your interest is and you've done the training and have promoted yourself and have helped some people do that, then it can bring a lot of joy to your day and you can help some people very specifically. So I say this one certification because it's been very helpful for me, but there's so many other ones out there that are really incredible too. Like for example, there's an Alzheimer's certification that I think one of my colleagues has done that has been very helpful for them too. I think it is really, really cool to be doing some niching so that you can develop some extra expertise and help someone more deeply.
That's good advice though, because I think sometimes for new grads, we feel like we have to have it figured out. We feel like we have to have a niche to stand out from the crowd. But what you're saying is help as many people as possible, get your feet wet, get some experience behind you, and then it will naturally evolve. Is that how it worked for you?
That's how it worked for me. Yes, that's how it worked for me. And even my colleagues, like I looked to one of my colleagues who was practicing very generally when they started. And then, it turned out that the way that the courses landed, it made sense for her to be working in chronic fatigue and to be doing iron IVs. And that's been incredibly successful. It can change a person's life, this one therapy. And it suited the niche that she wanted to go into. Yeah, so I'm inspired by that.
Tell us about your work as chairman of the board for the Canadian College of Naturopathic Medicine. I'm kind of interested to know what curriculum changes or what would be coming down the pipes for new grads.
For new grads. Okay, so we have what we initially called the enhanced curriculum, and now it's simply called the curriculum. We have a world-class curriculum at CCNM. What is it like to be a board member? Well, I've been a board member for many years. 9 years in total so far. I was the outgoing chair of the Boucher Institute of Naturopathic Medicine and was a key supporter of the merger between the two institutions, and actually worked on the merger for many, many, many hours. And I enjoyed that process. And so I became a board member, of course, of CCNM. And so I've seen both institutions deeply, and now the conjoined institution. I'm so incredibly inspired by the team that we have, the team that has been built there. I don't have any role in that. Of course, I am practicing in governance exclusively. So I have a fiduciary duty. I have an oversight duty. And the role that I have is absolutely perfect for me. I get to have some insight into how the academic institution is operating, and I get to have a seat at the table, you could say, in the discussions of where the academics go in naturopathic medicine, and I am very proud of the direction that has been taken. So we have this world-class academic program that is case-based learning, and that's how the top medical schools across the globe are teaching currently. And ours is guided by some of the smartest minds in academia. Many of our administrators have the OISE MEd, so the master's degree in education from University of Toronto. It's world class. And so the team of people who work there, they're educated through that program for a large part. So we just love the team. The research output from CCNM is enormous. All of the things we're using in clinical practice, the tools that we're using, are now being studied by our own institution. It's incredibly inspiring. And the people who are doing these studies are actually working in public institutions in addition. So we've got some really great collaborations that occur at the school. And that's really great for students to see, right? They're seeing naturopaths who are doing research, who are teaching at academic institutions and also have clinical practice. There's so many options now. And so for me as a board member, the partnerships we've made, the academic changes that have taken place, on the clinical side, the outreach and the equity that we're providing to communities, for example, for access to naturopathic care, is incredible. We have low-income clinics. We have tons of outreach opportunities for our fourth years. So I just love it all. Yeah.
Wow, it sounds like the school has really evolved. I graduated in 2010, so quite a long time ago. So it sounds like there's been a lot of updates and changes since then, including the case-based learning. That I don't think that was really introduced until my latter years. So that's great.
And the curriculum change is very much brand new over the last 2 years.
Okay. Oh, so it's really evolved even post-pandemic life. Wow. Yeah. Let's talk about personalization as a philosophy in practice, and why individualization and personalization are the future of care. Because I really suspect that patients want to feel special and really seen by their practitioners. And I think it sounds like you're that type of doctor.
I am. I absolutely am. And I do believe it is the future of care. And really it is the now of care. And you'd be surprised in certain circumstances where you think that it may not be, and it actually is. Like, for example, I met with someone very recently who had their cancer grade and stage confirmed through genetic analysis that was publicly funded. And this put their recurrence risk at a higher rate than you would typically think for the predicted grade and stage without genetic analysis. So this type of thing is being done in conventional care, personalized assessment. I have an obsession with objective assessment. So I like to have subjective assessment. I like to be able to chat and to connect and to be a good team member. And then I also like to have something on the page that we can watch. So that's really informed my personalization. You can think back, for example, to the VO2 max test where we test fitness. We also get 9 other scores, heart, lung, and muscle scores, that teach us how to help a person train so that their VO2 max can go up. And we've seen that. We had someone this week who started with a VO2 max of 24 4 months ago and now is at 43. And that's incredible. And this is not newbie gains. So newbie gains are when someone has never trained before and then just started training. They can get a lot fitter. than the person who has already training over the same duration. This person was well trained. And we simply made, easy adjustments to their program that suited their lifestyle. They had time for it and they liked participating. And their VO2 max went up significantly. And now they're in the optimal range, above 40 for their age, height, and gender. And so that's the kind of work that inspires me. We do a lot of conventional assessments. So of course, we use your conventional lab every single day. And we also do a lot of functional assessments, not for diagnosing disease because they're not for that, for helping people feel good and live long. And when you see a functional lab that informs a treatment plan that you may not have considered without the lab, and then within 2 weeks, their whole life is changed, you can't forget that. You can't forget that that lab changed the way that you approached what you were going to do for this person. And that's what I love. I teach lab diagnostics to nutritionists as a continuing education twice a year. And we were speaking this week about food sensitivity assessments and the controversy around them. And it's a very relevant controversy in this discussion because it's not diagnostic for anything. Having elevated IgG antibodies to a food does not diagnose a condition. But if you found that and you stopped eating those foods for a while and bloating and gas went away, and now you can actually participate in regular life, where was the harm? The harm was financial because you had to pay for the functional lab. And the harm really is if you can't make up for the calories and the nutrients through other foods, if you don't get a good nutrition plan, if you're not supported holistically while you're avoiding this one thing that turned out actually was driving symptoms. So not for diagnosing disease, but for helping a person feel good, live long, participate in regular life, and really be optimal for them. That's why I love functional testing. So long-winded answer to say that I think that what we do in this practice that we're quite proud of is we're good team members. We connect with people really well. We make ourselves available. We like what we do, so it's really easy. But then also, we're signed up with literally every lab across North America and some in Europe. Like we use all the tools that are available to integrative clinicians and we actually use them. Like we have them all in stock, for example.
Amazing. What would be your top 3 functional tests that you find you garnered the most useful information from? Not for diagnosis, but for insights into a clinical picture.
Probably the same as any naturopath that you would talk to. So having hormone metabolites. So not necessarily just the Dutch test, but a test that tests hormone metabolites like the Dutch test happens to be the one that I use the most. Stool analysis, because we all see people who have lower digestive tract issues. It's a very common thing in naturopathic medicine, and stool analysis can make a huge difference in the treatment plan that's going to be suggested. So we use both stool analysis from GI Map and US Biotech and even different other companies as well. We use all the companies, but stool analysis I think is incredibly valuable. And then the third one, I'd have to create a group for the third one because we do a little bit of everything. So this is aside from conventional assessments, by the way. We're just talking about functional assessments.
Yes, just functional.
But I think in the third category, you could put food sensitivity testing, SIBO testing, leaky gut assessments. I think for our clinic, you could probably put some wild cards in there where you might use a conventional lab but go outside of the box a little bit, like ApoB100 and LP little a and homocysteine. And we do a lot of those assessments as well. So having access to everything makes a big difference because we have a big list to choose from, but then also being mindful about cost and usefulness is a big part of the actual discussions that we have. So I think as a whole, those would be the 3 kind of categories that we focus on the most.
And this would have been all things that you acquired post naturopathic college, because I don't think those tests are included in the curriculum, at least when I was going to school. They weren't there.
You get a little bit of exposure in 4th year in your clinical practice. So basically in 3rd and 4th year, when a student is in clinic at CCNM, then they do shifts with different naturopathic physicians as the supervisors. And sometimes those clinics and those supervisors are using functional labs. So for example, at the campus that I went to, which is the Boucher campus, I had supervisors who used these assessments. So I did see them at school. And when they weren't used actually in the clinic, we in preview and review, we would have cases where those labs were used. So for example, let's say you're in a clinic where it made sense to use a functional lab, but it was too costly. For example, finances were a limiter. Well, then say, for example, in a review, a supervisor could say, if a person did do this test, here's what we might find, and here's what it actually looks like. So that's the kind of thing I did. But then the second thing that I did was pretty much every single functional lab that is available provides free clinical consults with their expert team. The teams are typically made up of either naturopaths, medical physicians, or people with PhDs in the field. I still take consults. I'm 10 years in. I still take consults very frequently with these labs. And I think they're invaluable, really. And I think that I recommend that everyone do them as much as possible for the first 5 years, or until you feel really comfortable with your treatment programs and have had success with your treatment programs. What they do in these consultations, they don't take accountability for any suggestions they make. They simply explain the result, and they very often would point you in the direction of the research or in the direction of a protocol that's been used before that may be supportive for improving this one objective marker you had. And so I use those and I take very detailed notes, and then I make individualized programming following those consultations.
That's a good tip too. So doctors, if they're interested in functional testing and they're not running it now, just reach out to different companies and attend the educational events, attend the webinars, and try to book in consultations with the team at the testing side.
The way that it works, so basically in the first 3 years of clinical practice, I was traveling quite a distance for not very many patients, for not very many consultations. In the first year, I would travel for an hour and just give a B12 shot and drive home. That's the kind of life that it can be in first and second year clinical practice. So if we did, for example, run a lab, say we ran a food sensitivity lab, I would then, at that time it was Rocky Mountain, now it's called Life Labs, I would have 30 minutes on the phone with them after the result came back. And I would get a sense of what they thought of the result. And then I would take that expertise into my follow-up. So when I went into my programming, I still do that with very, very complicated labs. So for example, in organic acids assessments, every time I do an organic acids assessment, I will have a consultation with the lab. And I learn something new every single time.
Yeah, the organic acid test does have a lot of different moving parts to it, doesn't it? That's a cool test. If you could go back and talk to your new grad self, little David, what would you advise him?
That's a good question. On the show, we've actually talked about this with practitioners a couple times because I think about this a lot because now I have this stream of athletes who have found me by chance. And I think to myself about how I really wanted to work in sport, but didn't think that I could. I didn't think as a new grad that there would be a space for me. I didn't think there was enough athletes that knew about naturopathic medicine. Turns out it doesn't really matter. What matters is that you have something valuable for them that's going to help them, and that they find out that you have something valuable. It doesn't really matter if they know about our profession. It doesn't. So thinking back, I think I could have been creating this stream immediately. I could have been not necessarily marketing myself towards athletes, but getting out there and meeting coaches and telling them about my expertise in nutrition. Now we have one naturopath who is a performance enhancement coach for the Phoenix Coyotes NHL hockey team. Like, that's the type of thing that inspires me. We look at Dr. Bubbs in Toronto and his experience with Canada basketball. I'm so inspired by that these people have actually been able to do this, to work at a high level. And if I had have really thought that was possible from the get-go, I would have maybe focused on speaking with the people who work with these athletes. I think the most difficult thing for me has always been the financial, being in private primary care. We didn't have direct billing for my first 7 years. And so people would have to pay out of pocket after they left my office. And for me, that was a huge barrier, a big barrier. Something about paying to chat with me was a barrier for me recommending frequent follow-ups, providing the optimal care that I thought the person needed. But since having direct billing and working with the population that I have and hearing their stories about how they value my care, I've sort of changed my tune on it. And I think if I had have spoken to someone like me initially, then my tune would have been different to start with.
So your mindset around money or what patients are willing to invest in their health has shifted over the years.
It absolutely have. There's nothing better than when in Canada, a person leaves a clinician's office with a really good experience and got something extremely valuable, and they walk out and it didn't cost much. Because they're used to walking out of their physician's office and it being free.
Right.
Walking out of the dentist and having their extended medical billed directly. Right.
Yes.
Like there's, especially in my community where I'm very fortunate in the sense that so much of this population has extended coverage.
Yeah. That
we're able to create an experience that doesn't have that significant burden immediately after chatting with me or after chatting with anyone in integrative care. You see a massage therapist, you walk out, it doesn't cost too much because extended coverage provided that value. And so that has been incredibly helpful for me. And I think that the patient experience is better when you have a really, really, really good front desk person who knows who makes it seamless, which I have now, which is excellent.
Wow, there's been so many good insights in this talk. Thanks, David. I really appreciated this. We covered practice, personalization. We talked about your background, and you gave some really good tips for our practitioners. It's been fun talking to you.
Thank you very much, Lydia. I enjoyed it so much. It's so weird for me to be on this side of the camera.
Oh, you did so well. There's so much good information shared. Thank you for taking the time.
Well, thank you.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Duizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.